Should you have a lumpectomy and radiation if you're thinking of ultimately having a mastectomy? This is something that comes up not infrequently in clinic, or I see patients who are treated at an outside hospital with a lumpectomy and radiation and then are referred to me for post-mastectomy reconstruction. And almost never are patients appropriately counseled on how this approach can impact your reconstructive options and aesthetic results. Let's start from the beginning. If you have a lumpectomy and radiation to treat your cancer, you are radiating the skin and the breast tissue that's left behind. Here's the challenge. When you then have a mastectomy, if the surrounding mastectomy flap, meaning the skin and fat that's left behind after the breast is removed, has undergone severe radiation changes, you might not be a good candidate for implant-based reconstruction. Some plastic surgeons won't even offer implant-based reconstruction with this scenario. I will, as long as the radiation changes weren't very severe, so what I would say is mild to moderate. And regardless of your radiation changes, you have a higher risk of getting capsular contracture, infection, basically every complication associated with mastectomy reconstruction. So sometimes it's unavoidable. I've had patients who have a lumpectomy and radiation and then they have a recurrence and they need to have a mastectomy. So that's not an avoidable scenario. But I occasionally see patients who have a genetic predisposition, think BRCA, have a cancer, they opt for lumpectomy and radiation, knowing that they ultimately want to get a bilateral prophylactic mastectomy. Maybe now's not a good time. That's fine, and I totally understand that, but you need to be told ahead of time this might remove you from implant candidacy or make your reconstruction not aesthetically as awesome as it could have been if you didn't have radiation. That makes sense? Let me know your questions in the comments.